Disaster procedures at Divine Providence. We have a number of them, and we'll go over them right now. When there is a tornado or severe thunderstorm watch or warning, we have the following procedures. We have a weather radio on the nurse's desk on the row's side. When it goes off, it makes an alarm. And if you hear that alarm, you need to go to the radio and listen to the message. Once you know the message, tell the row's charge nurse or any of the charge nurses what's going on. If it is a watch, it is announced over the intercom 87, which is the speakers on all the phones in the nursing home. And what we would say is we are in a severe weather watch until the time. And you have to make sure all the departments know, because sometimes they can't hear the speaker on the phone or the overhead announcement. Observe the weather outside and decide if the residents should eat in the hallway. Nursing and dietary will discuss that and make a decision. There is a to-do list located on the white notebook on the row side of the nurse's desk. Tornado and severe weather watch. We defend bed-bound residents in place after 9 p.m. and all other residents. If it is not after 9 p.m., we bring all the residents into the hallway that are ambulatory and can be brought into the hallway easily, wheeled in. And residents that are harder to get into the hallway because they're in bed, we will do after we get all the other residents in. And then a person that is remaining in the room in bed, you move the bed away from the window and you shut the blinds and make sure the window is shut. And then you cover them with a blanket to keep any kind of debris off of them. So during a watch, we would shut the windows and blinds. We would bring an extra blanket down the hall for each resident, staff, and visitor. We would count the residents and the personnel. We would use a daily log for that, and that is located in the report room on the clipboard. We'd clear the hallways. There are emergency power sources. 2 of them are at the nurse's station, and there are 4 near the fire doors down each patient hallway. We plug in an oxygen concentrator in the hallway for each resident that is on oxygen. We have a flashlight across from the nurse's station. Sometimes that isn't there, it may be in the treatment room, but if you still can't find it, we have all 4 dirty utility rooms have flashlights. Severe weather warning. For a warning, it is announced overhead ×3 all resident and staff report to safety in the hallway. You also announce it on the intercom 87, and again, make sure all the departments know because they can't always hear the announcements. For severe weather warning, employees evacuate residents into the following areas. Again, bedbound residents are taken away from the window and covered, and the windows and blinds are shut. We defend them in place. Staff, residents, and visitors are all taken into the shelter areas. All 4 patient hallways are considered shelter areas. Also the service hallway and the hallway off of the chapel. We'll show you that in a minute. We close all the residents' doors so the debris can't blow in from the windows. The service hallway, we shut the fire door at the end of the service hallway if they go in there. Currently, we have been taking the residents from the dining room and bringing them to the service hallway. Now we've decided to bring them down the patient hallways because sometimes we're in a warning for a long time and there's no bathrooms. There's the shelter area off of the chapel. Again, shut both sets of fire doors. It's also right off the Marion conference room. Again, all 4 resident hallways are shelter areas, and the same for the service hallway and for the hallway off the chapel in the Marion conference room. We have walkie-talkies. They are in the med room. Each nurse will take one down each of the 4 halls. The middle of the nursing home at the nurse's station has a skylight above it, so we can't sit there. We bring the residents' charts into the hallways if we have time. The main points I want you to remember is that it needs to be announced and people need to go to the shelter areas. And you follow these rules, you'll be safe during bad weather. Internal disaster. We rescue people first, obviously, and then alarm. We let other people know. You evacuate the affected part of the home. Utilities will be shut off by maintenance, and we'd evacuate if necessary, and we'll talk about that later. Flood. There's Rosie. She's looking at Sleepy Eye Lake. She knows it's getting very high. She feels that she needs to let people know. So she's going down the hallway to the nurse's desk to tell everybody the water comes, but she got there in time, so no one was harmed by the water. So again, you need to rescue people in danger for flood and alarm, and the same as the other disasters, maintenance would shut off utility and we would evacuate if necessary. Electrical power failure. We're equipped with an electric generator. It takes 10 seconds to come on to full power. It has emergency outlets for that generator, again, in the resident hallways near the fire doors and the nurse's station. If it goes on, you have to call maintenance. There's something they need to do to it. If the generator is on, we need to use less power. The kitchen will use emergency menu and disposable dishes, and the nursing won't give any baths or use any unnecessary electrical devices such as a TV or radio. Follow directives from the DON or the Rose Hall charge nurse. And residents would be evacuated if temperature can't be maintained. Bomb threat.
Good morning. You do not know me, but I know you. And I want you to be aware that I have placed a bomb in your facility.
You planted a bomb here? Where did you put it?
I'm telling you, don't look for it. I know your facility and you will never find it.
Hi, this is Jana at Divine Providence, and we have a bomb threat. It was just called in. The person is still on the phone, and we're trying to keep them on the phone. But I don't know how much longer she's going to be able to keep them on. She's trying to find out where it is, but she's not having any luck. All right. Is there anything we can do to trace the call? All righty. All right, I'll stay on the line.
Can you just tell me where you put the bomb? Because if it goes off, it's going to hurt a lot of innocent people. Can you just give me your name? Can you just tell me your name? Where did you put it?
You want to know who I am. You'll never find out. You want to know who I am. I'm not telling you. And when the bomb goes off, all these folks will go to the Lord. That's what it's all about. Don't try the 911 thing. I know where all the wires are. And I'll take care of that. I'm 77 years old and I don't have much vision. My sight is I'm losing my sight, but I know where to plant that bomb, and that's where I did, and you will never find it.
Ooh, kind of spooky. Let's see if I can get the computer to do what it's supposed to do. There we go. This is what happened when she was caught because of the great detective work done by our staff. Okay. Basically, for a bomb threat, you keep the caller on the phone like she was doing and ask when it'll go off. Tell them many people will be hurt, trying to make them feel guilty, and listen for any noises or things that the caller says that can give you a clue to who it is. Obviously, the police will be told and they'll search the building. We keep bomb threats confidential because publicity increases bomb threats. Bring no weapons into the facility, such as guns, knives, nunchucks, bows, and arrows. Community disaster. We're part of the community, and we will assist in any kind of a crisis. Our shelter areas are the Marion Conference Room and the Activity Room. Sleepy Eye Hospital will care for their patients using our facility as a refuge. We need to maintain our required staffing. Staff can volunteer for the disaster, but they can't do it if they would miss their shift working with our residents. And we don't let people into the facility that have some sort of a contagious disease. Evacuation procedure. We would evacuate on the advice from the police chief, fire chief, or some sort of common sense. Residents are gathered into the aviary. We take the census and make a list of who is all there. We get a head count. We assign residents to various employees to keep track of them, and we try to have them be evacuated either to the St. Mary's gym or the hospital or home with families. Again, the evacuation would be the St. Mary's gym, and we'd have to call the principal. All employees and volunteers will be asked to help with the evacuation. Employees assigned to the school will note the arrival of each resident on the census sheet. And again, we need to record where the resident has gone, the hospital or the family. Employee in business office will use the emergency phone list to arrange transportation and answer phones. Social service will contact families to see if it's possible for them to take their loved one home. The nurses will bring the med cards, computers, and charts. Housekeeping will bring supplies. Maintenance will shut off utilities. Dietary will bring paper products and food. Lake Villa residents are encouraged to go. They don't have to, but if they do refuse, let an emergency worker know. If we are closed for more than one day, our high-level residents would go to Sleepy Eye Hospital. The rest would go to the Orchid Inn. Staff would report to the Orchid Inn, and hopefully some residents would go home with families. We can go back into the facility when it's deemed fit to occupy. Missing residents. If a resident is missing, obviously check their room and other residents' rooms. Check the living room, the chapel, the activity room, the beauty shop, and the bird lounge. And see if family signed them out and didn't tell us, or it is possible family didn't sign them out and took them, so we need to investigate that. And if we cannot locate the resident after looking in these areas, we would need to notify, obviously, the charge nurse, and the administrator would know, the family would need to be notified, police would be notified, and once the resident is found, they'll be looked over for any sorts of injuries, emotional upset, and we would update the resident's plan of care. The end.